family, one tends to be a bit more drawn backwards. Then there'll be changes in personality where there decrease in, for example, interest in hobbies or activities which usually used to be of interest to the person. Then as the addiction progresses, missing important obligations, missing out on work, and physically may it manifest in changing in sleeping patterns, skin tone, hair, maybe some develop some type of trembling. The way how one should approach it definitely is try to speak to the individual on a one-on-one basis without confronting the individual in a large group of people. Voice one's concern, talk about it, show that you are there to help, maybe propose professional treatment. If the individual objects, take a step back and let him digest it, let him breathe. If you see that the individual suffering from the addiction is getting more and more at risk, more and more in danger, then maybe an intervention with the family could be warranted. And once he or she decides to enroll into a rehabilitation program, always, show support, show that you could be there for the person, but obviously always keep your own mental health and your own mental well-being at the center of it all. One should not get carried away into taking care of someone who is addicted and bring it upon himself when you end up being and you end up being in a negative situation towards yourself, because many people end up trying to help an addict and in the process creating a bit of a trauma to themselves. So this must also be kept in mind.
Other things that one can look out for is, if they're at work, maybe a lack of judgment and safety, where before they were more reliable. If they're operating machinery, for example, little accidents that happen that can turn into bigger ones, for example. You'll start seeing that many of them, depending on the substance of use, will start spending a lot more time trying to procure the substance, okay, trying to find it, trying to meet a pusher, for example. So it's more sick leave, they're less reliable, okay, or money that goes missing. All right, suddenly you go home, you don't find your TV set, for example. So that might be a good indicator as well, that, start finding small items of jewelry missing. I think the biggest challenge sometimes is for parents, because they never know whether their adolescent child is having, for example, outbursts because they're just growing up and it's just reactionary behavior, or whether it comes from a peer group, whether they're locking themselves in their room and becoming secretive because it's just teenage, typical teenage behavior or not. Okay, but if they start sleeping more and they're more secretive, and maybe you notice their friends are much, much older than they are sometimes they get to meet other people who are not very good role models for them as well. Okay, so many of them might be using a younger person to do little errands for them and pass drugs over to other people. So I would say behavior that is very uncharacteristic, which would really attract your attention. Like maybe as well, sometimes it's the whole circumstances. Okay, suddenly they're not doing too well in school. You notice that the friendships are not, the peer group isn't an ideal set of friends. And as Janice said as well, there's the aspect of sometimes there is denial in the family as well. The family is aware, but they still find it very difficult to accept that there is a problem. Sometimes it's because it creeps in slowly, sometimes because it's sudden, so psychologically they really can't take it. And sometimes unwittingly they give them more money, which means they enable them a bit more to procure more substances. Okay, so then we know there's a lot of pressure in the media as well. Okay, the media is constantly, unfortunately, sometimes pushing certain lifestyles as well. Okay.
And just to add something, so basically I agree with what was said, practically, and maybe something I might mention because of perhaps students following us, it's the trans-theoretical model of change, by Prochaska, Di Clemente. So that cycle of pre-contemplation, contemplation, preparation, action, maintenance, and that's a very simple way of sort of trying to stage different individuals in different stages of their addiction. So I'm in the contemplation stage, maybe I'm in the preparation stage, I'm in the action stage, or in the maintenance stage. So I have to make sure I don't relapse. I think that's a very easy way, simple way for students, and perhaps both healthcare students and sort of people in the workforce already, we use motivation interviewing. So I think you've heard of motivation interviewing, where we responsibilize the person. The person is part of the team. Okay, we empower that person. He or she sets goals, and it's very important that the person has to have the motivation to improve. Sometimes it's useless, for example, starting a rehabilitation program and you're not exactly motivated to do it, or you're forced to do it. It won't exactly work. Just to add those 2 points.
Interestingly, it's the model we teach in class usually. So, because it's a model which is not linear, it's a cyclical model. So, and apart from being cyclical as well, so the person initially, you can see most drug addicts they're still in what we call a pre-contemplation phase. So they're not, they're using, they're enjoying themselves. They know that, they need to increase the dose and they're not getting the same highs or lows they had before. So slowly, most of the residential programs as well help them go through these stages where you start weighing the pros and the cons. And usually people start deciding to do something when they see that the cons are really outweighing the pros now. If I don't do this program, most probably I'm going to be sent, maybe have a prison sentence now, rather, or maybe I'll have a probation officer, okay, assigned to me. And the good thing is that when people go through all the different stages, every time they are learning something new, they are learning new skills. A residential program will give them a very good structure to learn what it means to live a normal life again, what we call a normal life, where you wake up, have to make your bed, do the things that annoy you every day, which are boring. So that puts them as well in a very good position to develop skills like being assertive, to say no to drugs once they're discharged, for example. Or maybe some people have very low self-esteem, because that is sometimes why people start taking drugs as well. So when you work on these different skills, obviously, then you can go through the whole cycle and every time learn something. It's true, sometimes relapse happens. But other models would contemplate you starting right from the very beginning again, as if you're a lost cause. These days, with Prochaska and De Clemente's model, you see that you can start again and go back to your action plan. Just go back and say, okay, who is my backup? Who can I call when there are triggers in my life which will make me relapse? So I think it's a very smart model and very, very useful, very empowering to the individual.
If I may, I really like 2 things you mentioned. One, that a person might actually come for help when the cons outweigh the pros. And I think that's why it's really important to work on campaigns and educational sort of preventative models. And as you said previously, it's all about function as well. So when the cons outweigh the pros, then a person becomes dysfunctional. And I really like the way you mentioned that in each and every stage, a person learns new skills. Because when there's relapse, then it's not the end of the world. You learn new skills, you can use those skills to get back on track, and you do that cycle in a shorter period.
Thank you. So obviously this question, like you've already started discussing, leads me to ask about rehabilitation. So what is the basis of drug rehabilitation and how successful is it?
So drug rehabilitation would be a process where medical or psychotherapeutic treatment would be given to treat the dependency of the individual. So patients confront their substance dependence and then, if possible, stop. But it's rather a holistic way of dealing with the problem. So you can get psychological counseling, support groups, addiction counseling, and then also the medical side of it, where one gets pharmacotherapeutic help, medical care, psychiatric care, and drug use as such doesn't have a known etiology, doesn't have an exact cause. So it is important for effective rehabilitation to treat all types of facets of the problem, not just the addiction itself, not just the withdrawal. Where is the addiction coming from? Where is the substance abuse problem coming from? Is it because of psychological issues in the past? Is it because of a troubled childhood? So an effective rehabilitation program would address all different types of issues holistically, in my opinion. Chris.
As Janice said correctly, although rehab, everyone has his own idea of rehab. A lot of rehab programs have their own philosophies. In Malta, we're familiar with Narcotics Anonymous and 12 steps usually approach. But rather than actually labeling a rehab program, we must keep in mind that every individual has his own needs. And we may get people at the end of the line who primarily need harm reduction, and support from the medical team and the nursing staff is a priority rather than psychology, although it is important. But first, we have to make sure that our patients are stable. Eventually, yes, you will move on to the psychological needs, attend to the psychological needs of the patient, the social needs of the patient, because usually drug addiction brings about financial problems as well. The family needs of the patient, who would have probably got caught up in familial disputes to obtain means and ways to obtain his drug. So yes, rehab involves a multidisciplinary team again, but rather than just putting a name to it, we must keep the individual in mind first.
Chris, you mentioned harm reduction. Obviously, I cannot agree more, and it reminded me of how important it is to mention this to patients and to clients, because both in a rehab setting and outside the residential setting, because I mean, improvement doesn't happen from today to tomorrow. It takes time, and people will probably keep using until they decide to stop. They're strong enough, empowered enough to stop. So in the meantime, we have to promote these harm reduction strategies, such as, we know that avoid needle sharing, avoid equipment sharing, get safe needles. Ideally, if you have to inject in safe areas. Those are all things that will help the harm reduction process. Just to add that bit.
I wanted to add a little bit about the rehabilitation as well. It's true. In the initial stages, you need to have a period of detoxification, because an intoxicated brain is not capable of gaining insights that you give through, for example, psychotherapy. You can't develop new skills if obviously your mind is not retaining information and all the rest. So as Janice said, first you have to do it in a safe environment where slowly the person has to do a certain amount of detox. Once the physical dependency is not there anymore, and this is what I think most of the drug addicts don't look forward to, because it's very uncomfortable. It's like having chills and fever and nausea, and nobody wants to feel that unwell. But then what remains are the cravings, and that is where developing new skills and sort of exploring a little bit why a person is trying to block out emotional pain, why that is important to handle at a later stage as well. Because if you start it too early, what it will be usually perceived as emotional pain. And what they will do is they get a craving and they go to mute the pain again. And they go, it can be a trigger for a relapse, for example. So I would say one has to proceed with caution. Initially, in occupational therapy, we say that in the first phases, they don't have an internal locus of control. The person is not capable of, coming up with methods, to help himself too much. So they need to be perhaps in a closed environment where there is a structured routine. It's a bit like the military as well, where they start learning a new way of going through life. All right, and that is the basis of most residential programs as well.
Thank you all. Since we mentioned harm reduction policies, do you think that harm reduction policies, programs, and practices should be introduced? And if so, what would be the benefits of these?
I think drugs will always be available, and whoever wants to take a drug will find a way to access it. So I think regulation of certain substances and education of educating the public on drug use, on why certain substances can be harmful. If you have to take a substance, take it in a responsible way. You know, if you're going to party all night, you have to drink water. If you're going to take heroin, go and get a needle from a health center that's sterile. If you're going to smoke cannabis, try to choose cannabis that maybe has some CBD. All these issues, or educating the public and reducing harm is, I think, very important, because most of the harms caused by drugs are caused by irresponsible use. Usually, responsible use of substances can be done in a safe way, and most people can use drugs on a regular basis and irresponsibly, and will not have any health issues because of their use of drugs. And when it comes to regulation, obviously it's extremely important, because obviously the issue at the moment is whether cannabis should be regulated in Malta for adult use. We know that there are a lot of substances that are very readily available legally that are much more dangerous if abused than cannabis. For example, tobacco, alcohol, and they also have a higher addiction potential as well. And we know that many cannabis users, for example, get most of the bad effects from cannabis because they abuse it, they overuse it, and some, what was mentioned, people with mental health issues tend to maybe overconsume because they're trying to self-medicate, they're trying to feel better, and once they know they have a problem, they know that they cannot stop using the drug like cannabis, but they don't know any other way, of getting out of their habit. And once you educate them and you help them understand that they are using cannabis to correct, some maybe chemical imbalance, or maybe to reduce some pain, or maybe to calm the mind, to help them sleep, and you educate them on using it responsibly by, for example, combining CBD with THC, using it in moderation, vaping instead of smoking. All these things help the user to understand more, what the drug is doing and how to use it in a reducing the harm that it can do. I wouldn't say in a beneficial way, but when it comes to cannabis, some patients who use it therapeutically, obviously it will give them a health benefit. But not everyone obviously uses it for its health benefits. Most people who use it recreationally, or so we think, because they are regular users and because they don't have a medical prescription and because they get it from the black market, they are considered recreational users. But there are many medical conditions that respond well to therapeutic cannabis. So these patients who are using cannabis on a regular basis will be using it to help them sleep, to help them manage their anxiety, their pain, their depression, their moods, their menstrual pain as well. So many different reasons why someone might use a drug, and obviously educating them on proper use, to use it in a responsible way, will reduce the harm and reduce the complications of possible drug use, not only when it comes to cannabis, but even I don't know, party drugs, like ecstasy and cocaine. If someone has to use it, ideally the education to reduce harm associated with drugs will help them at least to use it by in a safe way.
Thank you. So since we are moving to the topic of cannabis, today medical cannabis is legal in Malta, and there are yourself. You manage a clinic, Dr. Ajus. You manage a clinic where your patients use cannabis as a form of pain therapy. So, what are the illnesses for which medical cannabis is used as a form of treatment?
So in Malta, cannabis can be prescribed medically for any medical condition that is chronic and that has not responded to at least one medication. The most common conditions where it is prescribed are chronic pain, so conditions like fibromyalgia, sciatica, failed back operations, migraines, for example. It's also used very much in cancer because apart from it helping with the cancer pain, it also helps with nausea, anxiety, and side effects of chemotherapy. And it's also being prescribed very much as well as an alternative to anti-anxiety and sleep medication, because THC is a potent sleep-inducing drug, and it's also very effective. And patients who have sleep disorders from various etiologies, various causes, find that cannabis helps them, calm the nervous system and helps them sleep, and so conditions like restless leg syndrome, post-traumatic stress disorder, all these conditions can cause sleep issues, and sometimes even some forms of anxiety. Patients seek cannabis, therapeutic cannabis, as an alternative to antidepressant medication, which some people don't tolerate very well. Patients with especially hypersensitive nervous systems, with fibromyalgia and these kind of conditions, they're usually very sensitive to pharmaceutical medications, and so they get more side effects than actually therapeutic effects. And in these cases, medical cannabis usually provides very good relief from many or some of their symptoms, and it helps them lead a normal, ish life, you know.
Thank you. Are most patients keen on making use of medical cannabis as a form of treatment?
Well, patients who are in pain, you know, and patients who have cancer, and patients who've tried a lot of different medications usually seek an alternative because they want to lead a better quality of life. So these kind of patients usually would try anything to improve their quality of life, because very often they feel like they're not living, you know, a normal life. So in these cases, usually the patients would come specially requesting an alternative, cannabis, you know, to help them. Unfortunately, there is, I feel that the medical community in general needs to be better informed, you know, about the therapeutic effect. There is unfortunately quite a stigma when it comes to cannabis, and sometimes patients are misinformed, you know, about it being therapeutic and its possible pros and cons. You know, very often they're advised not to take it by other doctors, including, unfortunately, some pain specialists, you know, and they're even offered morphine as a first line instead of cannabis. You know, morphine is very readily prescribed. We can issue a prescription in under a minute. The patient can go to the pharmacy and get morphine in less than a minute, you know, with a prescription, an urgent prescription. But to get medical cannabis, the patient has to wait 1 to 2 weeks for approval from the superintendent of public health. They need to have certain documents, certain control cards, you know, and there's a lot of excessive restrictions for a substance that is relatively safer than medicines that are already available, you know, for example, opiates, you know. You can easily go to a pharmacy with a headache and get dispensed a preparation with codeine, for example, which is an opiate which has a much higher abuse potential than therapeutic cannabis. So I think education is key. You know, it's very important that the general population and also the medical community are better informed, you know, about the therapeutic effects of cannabis, and hopefully patients will be able to access it more easily, because at the moment there's quite a lot of restrictions. You know, patients need to come regularly for prescriptions, and they need to get their approval renewed every 6 months. It's quite a big deal, you know, quite restrictive for a patient to access medical cannabis. And we haven't even mentioned the price. You know, obviously the price is still too high for most patients who need it. And hopefully these patients eventually will get the right to be able to even grow their own medicine if they need it therapeutically, and they cannot afford the high prices that are dictated by the pharmaceutical companies. Hopefully they'll be able to access it and be able to self-medicate with you know, a plan that is natural and that can help them manage their symptoms.
To continue with what Dr. just was saying, fully agreed about the stigma, fully agreed that the medical community as a whole needs to be more educated about the benefits of cannabis, as the public needs to be educated. Another thing is that the only the form of cannabis which is at the moment legal in Malta are the flowers. And the way to consume these flowers, one of the ways to consume the flower, the most popular way to consume the flower, is either smoking it with tobacco or vaping. Now, smoking it with tobacco is obviously not medically recommended, and vaping by some people might be a bit, I mean, maybe an elderly individual might not